What you're feeling is your hormones evolving. Today I want to walk you through what actually happens inside your body as you move from premenopause to perimenopause and finally into menopause and postmenopause. Why it matters and what you can do about it to help yourself. I hear it all the time. Women come to me saying, I'm exhausted. I'm gaining weight, nothing works. I'm anxious. I can't sleep, and I just don't feel like myself anymore. And I always tell them, you're not crazy and you're not broken. Although I will be discussing the different time periods and when these things happen for the majority of people, keep in mind that things happen differently for everyone, right? Just like many women get their periods some earlier, some as early as 8 years old, where others won't start menarche or start getting their menstrual cycle until they're 15 to 17, right? The same thing goes for perimenopause and menopause. It happens at different times for everyone, and today I will just be rounding it out with the norm where the majority of people go through these changes. Okay, so let's talk a little bit about the evolution of women's hormones. So we have the three main sex hormones, progesterone, estrogen, and testosterone. These hormones are primarily made in the ovaries during premenopausal years, okay? So if we look at, by age and by what is happening and occurring through the transition. So, you can see here the adolescent years, the childhood years happen, and we have very low sex hormones, barely any. And then they start to increase as we enter our preteen years or end of adolescent years. And, for different women, it happens at different stages, but menarche, which is the beginning, the first time you get a menstrual cycle, your period, it occurs sometimes, usually around between age 10 and 14. In most women, although we are seeing it younger and younger these days, we see girls as young as 7, 8 years old getting their period for the first time. But this could happen usually, menarche, the start of your period happens somewhere between age 10 to 14 years old for the majority of women. And during this time, our sex hormones, these three hormones, are increasing. Now, I know this graph looks like they stay steady, but truthfully, month to month, they wax and wane throughout the month. So it really looks more like a roller coaster for all of these hormones during your premenopausal years. But they are closely intertwined and they have a specific ratio that these hormones follow, so people feel at balance. Premenopausal years, this is when our body's working in harmony. Now, lately, I'm seeing very frequently women go through early perimenopause and even menopause, as early as the early 30s sometimes. And again, we think this is due to exposures to different endocrine disruptive chemicals. Now, when we look at the end, when this perimenopause starts, okay, these sex hormones. So you can see here that testosterone increases very early in the premenopausal years, and it begins to decline sometimes in the late teens, early to mid-20s, to be honest. So this hormone starts to decline there. Progesterone, it begins to decline usually early 30s, mid-30s. We see it up to the 40s for some women. So you can see here perimenopause starting for some in their 30s, and that's when the progesterone first starts to decline. That's the first sign, but estradiol at that point stays the same. So that decline in progesterone leads to that ratio of estrogen to progesterone being off. That's when women will first notice these symptoms. So oftentimes the first symptoms of perimenopause include things like irregular moods, so like mood lability, the ups and the downs, worsening of your PMS symptoms, that's one of them. Sleep difficulties, so that decrease in your sleep quality. Huge, that's huge, because progesterone, the hormone progesterone, it's metabolized in the brain into something called allopregnanolone, and it binds to the GABA receptors, which help to calm you, to keep you relaxed, okay? And as that progesterone declines, that leads to a decrease in allopregnanolone in the brain. This leads to irregular sleep and this mood lability. Those are two of the main complaints that we get early on in perimenopause. So you can see as that progesterone declines, estradiol remains it's still elevated in the regular normal range at that point. But then what happens as perimenopause continues, that estradiol begins to fluctuate rapidly. I mean, in the morning, an estradiol level could be 5, and at night it could be 200. So from day to day, really hour to hour, that can change. So this leads to worsening symptoms such as hot flashes, night sweats, joint pain, dry eye, there are a million, cramping, again, sleep difficulty, depression, anxiety, hair loss, more sleep abnormalities, decrease in libido, vaginal atrophy, vaginal dryness, to name just a few. But you can see as this goes up and down, the estradiol level changing leads to those symptoms for women. Eventually, we hit menopause. Menopause is 12 consecutive months without a period, and then we enter postmenopause. So believe it or not, most people don't know this, but menopause is one day. One day is menopause. So it's one day in your life. It's exactly 12 months after your last period, menopause, and the next day you're postmenopausal. That's a fun fact for you right there. Throughout the rest of our lives, we can continue through postmenopause. And symptoms of postmenopause, cardiovascular disease, osteoporosis, osteopenia, dementia, cognitive dysfunction, all of these chronic illness states are due to a decline in hormones. So fortunately, there is help, right? Bioidentical hormone replacement therapy started early will help improve your outcome and decrease your chances of suffering with these chronic disease states. That's why I tell my patients, you can't fight menopause, but you can support it. And that's where the magic happens. Okay, so let's talk a little bit about what you can do about these things, right? It's important that we first test your labs and see where you are. And we will use those to help us determine where are you in your peri or menopausal game per se, right? And we're gonna look at your symptoms along with your lab work to decide how, in fact, to treat you. Now, there are many things that we can do prior to bioidentical hormone replacement therapy to help support your system. Some of those things include managing your stress, helping to improve your sleep quality and length, okay? We can help with things like supportive nutrition, so helping with increasing your protein intake, increasing your fiber, your antioxidants, and other things and specific supplements that may help to support your natural system and increase that hormone production. Oftentimes we can do these interventions before bioidentical hormones early on in the perimenopausal game. We also want to take a look at your movement and how much exercise you're getting per day, how much sunlight you're being exposed to as well. Now let's talk a little bit about BHRT. Okay guys, let's talk a little bit about bioidentical hormone replacement therapy. But before I talk about that, I always start with the foundation because hormones can't thrive without the basics: nutrition, sleep, movement, stress management, and connection. These are your pillars. They tell your body, I'm safe, I'm supported, and I'm ready to heal. Okay? Once these pieces are solid, then we talk about BHRT, bioidentical hormone replacement therapy. But here's what I want women to understand. BHRT is not a shortcut. It's not a magic fix. It's the cherry on top of the work you've already done. It's the fine-tuning, right? These plant-based hormones are identical to what your body naturally makes. They help you feel the benefit of all those foundational habits: the clean eating, the good steps, the movement, the mindset. Every woman's journey is different, but the message is the same. You're not alone, you're evolving. Your hormones are changing, but you have the power to work with them, not against them. I'm Dr. Nicole Waterhouse, nurse practitioner, and this is how we help women feel like themselves again. Those are the facts.